All right, thanks everyone. Obviously the governor's not here. Not sure the mayor is going to be here today, so she's not. And so welcome. We are just going to have a short agenda. The city informed us last night that they're not ready for their presentation, so we'll push that back on the agenda. So we'll have 20 minutes for at the end of this meeting. So with that, I have no opening remarks other than welcome back, and sorry that you had to come back in July. Some of you are still looking at some vacations. So with that, if you could give a city update, Council President, Vice President.
The only thing I can say is welcome to the City of Flint. Welcome to each of the members of the committee. I feel this is an exciting time that we are halfway through the year. I've seen many of you have worked on a lot to address the issues of this water crisis in the City of Flint. And I think as we continue, this will all make a difference as we move forward. Thank you.
All right. Commissioner Curtis.
Thank you, Harvey. On the CPOD situation, 1's open, operating, 3 is open, operating, looking for a replacement site. Current site on Stewart Avenue is being cut off by construction, and the local EOC has a possible lead awaiting a point of contact at the site. 6 is open, 7's open, 9 is open and operating, alternate site at former Kmart site off Door Highway is being worked out through Sears Corporation. 5, Old Farmers Market, they're still working with Uptown folks on that. 4 is the East Side Compassionate Mission lease agreement has been executed. Site will be set up with required equipment this week. Physical address is 2804 North Franklin, Flint, Michigan. Site will open on July 5th, so it should have opened Tuesday, with messaging to being late July 5th, early July 6th, to allow time to work out some kinks at the site. The COPD 8, possible new 8 site is being explored, the new site at 2510 Fenton Road. And 2 is TTMB received the signed agreement from St. Mark's Missionary Baptist Church yesterday via fax. The open date and said July 1st, so a revision of the one page has been sent to St. Mark's, and that site should open on the 11th per the agreement. Moving on to the 36-inch water line at the water treatment plant. The county has received a letter from Mayor Weaver asking the county to go ahead with design and build, or not build, but design of that 36-inch. The county has retained Wade Trim, and we're looking to have that design completed and back from Wade Trim early August. And that's the update on that. Thank you.
Any questions for the city or the county at this point? Okay, seeing none. We have a water quality update. So, Keith.
With your permission, Harvey, I'll ask George to give that.
Good morning, everyone. What I'd like to talk about this morning is the results from the extended Sentinel program, the second round. And basically the overall theme is that the numbers are showing resiliency. We got some pretty good news here. We had 175 samples taken in the second round, and of those, 158 were at or below 15 parts per billion, which is 90.3%. Even more encouraging is the fact that the Tier 1 samples, which are the ones that are counted in the lead and copper rule, whether they have lead service lines or meet the other criteria to meet a Tier 1 site, we had 104 of those, and of those 95 were at or below 15 parts per billion, and that was 91.3%. The other thing that's encouraging is that our extreme ranges continue to moderate. The range of values in this round went from not detected up to 283, which is a little bit higher than the previous round, but still well below what was happening when we were doing the initial rounds, where samples were well into the thousands. So that is a very encouraging thing. The data overall is a little bit down from the first extended Sentinel round program, but as I indicated, the theme is resiliency, because there are some factors at play here that we knew were going to have an effect on the results. So number one, temperature. As the temperature goes up, the concentration of the lead is going to go up. And so the fact that it went up as little as it did is very encouraging, because we had very high temperatures while we were taking these samples. In addition, the Flush for Flint campaign was not in process at this time, so these results are the first set of results that were held external to the Flush for Flint campaign. So one of the things that we do want to point out is that we really strongly want to encourage residents to resume normal usage patterns of the water. This is the one thing that's going to provide the most benefit to the system as a whole, and with respect to the plumbing within their homes. And when I say normal usage patterns, I want to make sure that I'm clear. We're not saying anything along the lines of don't drink unfiltered water. Make sure you use your filters, but use the water just like you normally would. Bathing, watering your plants, doing the things that you normally did, and just making sure that you utilize filters for any purpose where the water would be used for consumptive purposes. So with that, are there any questions? Yes?
What are the dates of this testing?
Hey, Dr. Tisha, could you?
The dates for that testing?
Yeah, we began on the third Tuesday of June was when we initially started picking up the samples, and I think that was, I can't remember the exact date of that.
Wasn't the flushing campaign in May?
Yes, it was.
So it was after the flushing?
It was
Oh,
after
it was
the,
after the
that's
flushing.
what I was saying. This is the
Oh, oh.
first round
After the
where
flushing.
the flushing had, you
Okay.
know, was not actively taking place.
What about the analysis from the residential samples that are coming in? So these are from the Sentinel sites. What about the residential sites? Because on your website, you have them both. You have the Sentinel ones. and-
Right. They continue to show a similar pattern where it's right around 90% are at or below 15 parts per billion. What we're going to be doing is we're going to be segregating the data a little bit moving forward for a couple of reasons. We're going to have one spreadsheet that has everything up through June 30th, and then we're going to start compiling a new spreadsheet from July 1st moving forward. Number one, so that we can see the effects of what's taking place with higher temperatures. And secondly, it'll make it a little bit easier for residents to look at the new spreadsheet and find their results, because the old one has over 20,000 different fields in it. So this will make it a little easier and quicker for people to follow up. I will say that interestingly enough, it's the Tier 1 sites that seem to be healing faster. And so part of the process that we need to look at is some of the reasons why that's happening. Part of that may very well be education and outreach. We have worked with these folks that are in the program, and you know, we've provided the education with respect to the benefits of normal water usage, the benefits of cleaning aerators, all of the things that are necessary to take place. And so moving forward, education and outreach is going to be an increasingly large theme in what we do.
Quick question. You're at 91%, you said, at 15?
90.3% for the whole round.
I was thinking more of the tier ones, the
Yeah,
LCR
the
tier
tier
1.
one was 91.3.
Do you have any data, and you shouldn't, but do you have any data on where you would be if we were down to 10? The LCR recommendation.
Oh,
That was
what
taken out.
percentage?
Yeah.
I believe that number is in the neighborhood of 85% at 10 parts per billion or lower.
Okay, thank you.
If I could, so we did run that number, and we get that number to the committee members. The other thing to highlight in George's report, and that the recommendations from this committee, was to make sure that the sampling occurs during the summers. And so this helps solidify that recommendation with some sound data, saying that it may be fine in February or March, but we ought to be looking at July and August when temperature support some of the committee recommendations moving forward.
Sure.
I have a question. I know that not all homes in the city of Flint have.
Could you speak up to the mic because they're recording it? Thanks.
I know that all homes in the city of Flint have not been tested, and a lot of residents are saying they don't want to get tested because they don't want their addresses printed for the public to be able to see. Is there a way that residents can get their home tested that is not published, that they will be the only ones to get the results?
So I'll take that question, George, if you allow me.
Please.
The answer is yes, but. So once you submit a sample, you are subject to FOIA. And in those cases, the answer would be no. But your direct question is do we have to publish it on a website? Not necessarily. If there's a reason that someone wants that excluded and they identify it ahead of time, we could take that outside the normal process.
Okay, so one of the things that this may be a way for us to be able to get more homes tested, for residents to know that this may be an option.
Yeah, and part of the art in this is that under the EPA order, the 1431 order, it asks us to post results to that website. So you have a legal instrument that says we need to post it to a website. So we'd have to have a workaround relative to that enforcement order.
I think there's two other options. I think Sean's group and Dr. Edwards' group is doing water testing that's independent. So that might be a way for people to get their water tested, not through this process.
Yeah, and to that point, the number of residential samples have significantly declined over time.
Can I offer one other suggestion? They still could be posted without identifiable information. So we could go down to a neighborhood level, or report a street. And I realize that's going to be harder. People won't be able to identify their exact number on there just by looking it up, but maybe they could receive a written notice.
So there's a couple points to your comment. Number one is there was the request for some specificity, and there was a request for some individuals to know in a timely fashion. So now we're making the assumption that they don't want to be identified necessarily in a timely fashion. That's the reason why. So there was a subset who wanted to go to the internet and get the results. And so how we manage that tension point between those that want instantaneous results so that they know what the results are so they can take the appropriate precautions for their family, and then those that say they don't want that posted. So that would have to be very clearly articulated on the sample. And then, at least when I sat in the room, there was some desire to have more specificity in the location based upon the 1431 order.
So yeah, with all due respect, when last year when people really started getting their water tested, a lot of them certainly spoke up and wanted to have their values known, and so everybody could look at everybody else's to see they weren't alone. But I think since that time, with concerns over property values and insurance policies and all these other things, I think that maybe some more privacy protections are in order. And I know that Mark, I don't know exactly what Mark does, but I know when we sample, we send out a letter to residents, and that letter actually doesn't even have any identifiable information on them other than the sample ID number.
Right.
But so, and I understand there's logistics behind this. It's a nightmare, but I do worry, based on the feedback I've been getting from residents, just the privacy issues.
Yeah, and so certainly support that concern. If we can work through academic institutions that don't have the same disclosure requirements that a state agency has, we'll be glad to explore those avenues.
Okay, are there any other questions? Yes.
Just to add that the City of Flint would greatly value the information as well as we develop our strategy and protocols for complying with the lead and copper rule going forward. Thank you.
Okay. Seeing no other questions, let's move on to the Legionella study, Phase 1 update. So that is Mr. Becker? No?
No, I think that's me.
Oh, Wayne State team.
Thank
Okay.
you, Harvey.
I'm sorry. I was going to put Becker on the spot. I'm just anxious to do that since it's your last day. All right. Go ahead, Sean. Sorry
Great.
about that, Dr. McMurray.
Well, no problem. Thank you, Harvey, and thank you, everyone, for this opportunity to present some of the work that Paul and I and others, which I'll introduce in a minute, have been doing as part of the Flint Area Community Health and Environment Partnership. This was a partnership that was formed early this year to try to address concerns related to Legionella and the number of cases that have been observed in the last 2 years. And today's presentation, I'm really happy to be here, is certainly comes with a sharper focus considering the most recent report of a case of Legionnaire's disease in Genesee County. So, my role in that, as well as the others on the team. So many of you may recognize me from around the community. I've been working in Flint for a number of years, specifically focused on this water crisis last year. But in January 2016, we were notified by Harvey Hollins asking very simply if we could do an independent evaluation of a possible connection between the number of cases of Legionnaire's disease and water quality changes that occurred in the Flint distribution system. So that's a very challenging task, and we let Harvey and others know that that was a difficult thing to do. And as part of that, we broke this into 2 phases. And so the point of the presentation today is to clarify what we've been doing as part of Phase 1 and a little bit more about Phase 2. So the purpose of Phase 1 was to identify essentially knowledge gaps and develop a plan for improving the health of Flint residents related to Legionnaire's disease. And I say this because, you know, my primary area of research is on water quality, but was not focused on Legionnaire's before this problem developed. And when I started digging into it, I was amazed at the scientific gaps in knowledge related to Legionnaire's. And those gaps actually inhibit public health response. And so that's one of our major focuses, is to try to address some of those knowledge limitations. And as part of that Phase 1 process, we put together a team to essentially implement Phase 2. And so Phase 2, we are focused on addressing these gaps and reducing that risk to legionellosis. So I want to set the stage here and point out that the increased number of cases that were observed the last 2 years in Flint certainly were out of the ordinary, and they were elevated, but that overall there is a national trend as well as a statewide trend in increasing number of cases of Legionnaire's disease. And so the figure on the left shows the number of reported cases per 100,000 people over time, so from 2000 to 2014. And this data is from the CDC, and this is national data. And you can see that there's a clear increasing trend. The data on the right shows the number of Legionnaire's disease cases reported in Michigan. This is from MDSS's surveillance system. And essentially the same time period, although it's a little shifted, from 2002 to 2015. And you can see a very similar increasing trend. So the problems that were observed in Flint are not just an isolated incident, and they are problems that are of concern to the state as well as nationwide. So the key objectives for our Phase 1 portion was to really engage the community, get on the ground, talk with people more than we've done in the past, but specifically focusing on Legionella and Legionnaire's disease, and find out what is needed, find out what resources there are, find out what people are doing, so that we can do this in partnership with residents as well as all the groups that are working in Flint to try to improve residents' health. So as part of that process, we tried to identify gaps that might inhibit the rapid identification of Legionnaire's disease and Legionella risk, and then try to improve some of the risk mitigation strategies. So, the third item that we were really focused on was identifying communication strategies that could be more coordinated so residents don't become confused or overwhelmed with information. And so that requires just a little bit more work on our end, and when I say our, the academic side, as well as the state and local government groups to get together and talk about what kind of information we have and what information we're sharing so that it comes out in a more clear and coherent form so it's more easily actionable by residents. And then the last piece here, which I think was the most important, is that we were able to assemble an independent, multidisciplinary team. And I'll show you in my next slide this team, but the team is very broad and has many experts from areas of science, social as well as physical sciences, as well as multiple institutions. So we have researchers from the University of Michigan, one of who's joined us here today behind me, Professor Nancy Love, water quality expert. To my right, Dr. Paul Kilgore, a medical doctor and epidemiologist. And I have also with us here in the back corner here, Laura Tremor Spears, who's going to serve as our project manager for this project. But in addition to that, we have people that specialize in social work. We have gerontologists, a whole slew of experts that can try to help make sure we address all the needs of residents, not just specifically the biology or chemistry that I might personally be more interested in. So the objectives for phase one were essentially to come up with a plan that we could implement to address the concerns that we identified. And so that plan then becomes phase two. And so for phase two, our objectives are to reduce the occurrence of Legionnosis cases, as well as the outcomes of those cases that for people who are stricken with Legionnaire's disease. And this is something that I'll talk about later, but one of the real keys when dealing with Legionnaire's disease, and I'm sure Paul could speak to this better, is early detection and treatment really help to improve the health outcomes. And so I know there's a lot of concerned residents, quite frankly, scared residents that have been through an enormous amount the last 2 years and continue to deal with water quality issues in their home. Those residents, I want them to make sure that they understand that, you know, going and seeing a doctor when you think you might be sick is really, really important. The second objective is to define potential sources of Legionella exposure. And one of the sources that we're going to look at very specifically is there a potential for exposure in individual homes. This is something that has been alluded to in the literature, but we don't have any really solid data. And so one of our goals is to make sure we have really scientifically rigorous data to define what that risk is. We'll also be looking at high-risk facilities, such as high-rise buildings, hospitals, and other areas. And we've been communicating with a number of people to try to make that happen. The third is to develop an evidence-based approach at reducing Legionella exposure among Flint residents. And the evidence-based piece here is a really important word. There's a lot of scientific knowledge related to Legionnaire's disease from a medical perspective, how to treat it and whatnot. But from an environmental perspective, there's still a lot of unknowns about what causes it to grow, where, when it becomes a problem. And so we can speculate based on our scientific understanding of things, but until we have hard data, it's really hard to come up with a clear strategy, and that's one of our main focus areas. And then last but not least, and certainly not least, we really want to strengthen the existing capacity within the community. And this speaks to, you know, the needs of individual residents as well as local government, the city. We know that, you know, I'm not a resident of Flint. I don't pretend to be. And, you know, these are the people that are going to be working through this for many years to come. I hope to be a part of that and assist them with that, but I'm not going to pretend that I'm a Flint resident. It's the Flint residents who need to be able to address this enormous challenge. So as part of our activities, we're going to make sure that we are very transparent in delivering information. We do that in a very timely manner. And the education and outreach that we will conduct will be targeted to improve the recognition and prevention of legionnosis. We're going to be monitoring water quality within homes, and you know, this is something that I've been working on since last year with Flint residents, and I'm always amazed at their willingness to provide me access to their homes, and I look forward to continuing to work with them to try to address this. We're going to try to assist facilities. This is something that Genesee County Health Department has really been spearheading and pushing hard on, and we look forward to assisting them in trying to help facilities mitigate the growth of Legionella within their own local water systems. And then we want to connect residents to existing programs. There's a lot of work that's being done here in this room as well as out in the community with community groups, a lot of different community groups that we've met with that are doing great work, and we want to connect residents to those groups for support. And then finally, at the end of this, we want to develop tools and methods, protocols, basically lessons learned that can be taken away to other areas in the state as well as around the country that can help to reduce this problem so people don't have the same issues that have been experienced here in Flint. One component of what we're doing and that I want to highlight is the enhanced monitoring. And this is something that we're specifically adding and contributing to, in that we'll be performing a full water quality assessment. This means that we're not just going to go and try to determine if Legionella is present, but we're also going to try to identify the chemical parameters that are there to determine when there is a higher risk for Legionella growth. As well as we have some more advanced techniques that we can apply, including whole genome sequencing of DNA if we need to try to better match samples that we observe in the field with potentially case or patient samples if that need arises as requested by the state or the county health department. And then the real overarching framework for what we're doing here really is a rigorous sampling design and analysis so that at the end of this we have solid data. That means that we're doing things with a statistically robust sample size. We're looking to collect samples from at least 284 homes in Flint. That's not a small sample size. That is extremely expensive, extremely taxing. But I think together with residents we can get that done. We're employing comparison and control groups, so not only in other areas of Genesee County and other counties in Michigan. And we're implementing all sorts of rigorous scientific controls, internal, external quality controls. So what's next? The residents of Flint have seen a lot of me. They're going to see a lot more of me. They're going to see a lot more of my team. We're going to start implementing our water quality plan. We have received approval from our institutional review board that reviews the procedures that we do, and we're conducting things in an ethical manner. And we are continuously working with residents, and some of those residents are actually on our team. Dr. Laura Sullivan, who usually joins this group, is one of those key members that really helps to keep us grounded and make sure we do this in a way that's very respectful for everyone. We're going to work closely with public health, with Dr. Mark Valachek to my left here, Genesee County Health Department, the State Health Department, and all the groups that are focused on reducing exposure and risk to Legionella. And last, I want to just kind of close by encouraging residents to understand the risk factors for developing Legionella. I know there's been a lot of focus on kids in Flint, and that is, certainly appropriate given the concerns with lead, and I don't want to take away from that. But there's, an elderly population here in Flint, and that is primarily who are susceptible to contracting Legionella. People that are former smokers or current smokers, people that are over the age of 50, people that have chronic lung or respiratory conditions, or are immune compromised are particularly vulnerable. And so that immune compromise could be that they've had an organ transplant or are on medication that might otherwise reduce their immune system, and Paul could speak more directly to that. But if you feel like you are not well and you have concerns, go seek medical attention immediately, and let a trained professional diagnose, and if necessary, they'll treat the conditions. So if you have any more questions on that, I'll refer people to the Genesee County Health Department. They've got a great team, and I know they're working hard on this. And additional information could also be found at our website that we set up at flint.wayne.edu. And so I'll just close there with my contact information, Dr. Kilgore's information, our FWICC team, as we call it. It's quite an acronym, but FWICC team, we have a website that will certainly become more robust as time moves on. Residents can call us, email us. Right now, we only have a direct line that is a local number to Detroit, where I am based out of, but we have an 800 number ordered, and it's just not online as of last night. It should be shortly. But before I end, I do want to say that I really think about the people of Flint that have been dealing with this for 2 years or longer, and I really respect them. They are incredibly powerful people. They have gone through a lot, and I think that together we can do this, and we can come out with some really great information that will help to better address this, not only for Flint, but the rest of the country. So I'll end with that, Harvey. Thank you.
Thank you, Sean. Questions? Mr. Jones?
So let me begin by saying thank you for the presentation today, and I'm looking forward to learning more about the results. My question is specifically related to the kind of data that you're collecting when you go into homes. So we've been having some conversations back at the City of Flint, and one of the things that people have talked about is this idea that in some cases the fixtures in the homes may be leaking lead into the water. And I'm not sure if you've heard that, but wanted to find out if there's a way to test some of those fixtures to find out if they might be leaking lead into the water and contributing to some of the high lead counts, but also some of the risks for Legionella.
Yeah, so thank you, Sebastian. It's good to see you again. Certainly when it comes to lead, and this is part of not specifically the focus of FWICC, but certainly some of the other work that I've been involved in through a National Institute of Health grant, specifically looking at that. But the fixtures in homes are certainly a potential source of lead. In some cases, that is the primary source of lead. The only way to really get a hold on that is to do more in-depth, detailed sampling. So the first draw sample that is typically collected and is part of the Sentinel program and whatnot, that 1 liter is intended to capture that volume of water that is within those pipes. But defining where that lead's coming from, if you have a first draw sample, requires additional sampling. And I've done that for some residents, and I can do that to best of my abilities as far as I can do for other residents. But I know Director Cray and others at the State of Michigan are very concerned about this, and I've been talking with them about ways that we could improve that sampling. I know this is something that Mark Edwards and the US EPA have worked on, but as far as what we're looking at on FWICC, that is not something we're going to focus on. Focusing on Legionella, and we will be collecting samples from multiple points within the home. So we're going to be collecting samples from the kitchen faucet, the hot water heaters, the showers, all these different areas to try to get a better understanding of what the real risk factors are and where this might be coming from. So I hope that answers your question.
Sean, if it's okay with you, I'd like to just kind of add on to what you said to address Mr. Jones' question directly. I can tell you, based on the testing that we've done in the schools, that the fixtures are absolutely a point of exposure for lead getting into the water. When we were doing the sampling in the schools, we were taking 4 125 milliliter samples. 2 of them were first draws, and then we had 2 flush samples so that we could pinpoint exactly where the lead was coming from. And in the schools, the primary source of contamination was right there at the fixture, and some of the supporting plumbing, such as brass valves and things of that nature. This is going to be a larger and larger issue because it wasn't until January of 2014 where they redefined what lead-free meant with respect to a fixture. So prior to that point, brass fixtures could contain as much as 8% of lead. So it is a very real issue.
And if I can just add, nationally, people are seeing this. For example, Portland, Oregon right now is in a lead and water crisis, and they don't have any lead service lines. It's lead coming out of their fixtures and solder that's causing the elevated lead in the water because of a corrosive water source. So it's not the lines. And these fixtures, 2014 was just a few years ago, so you have to find, faucets or whatever that were built after that. So it's a it as a provider to be on guard. But my understanding was that person had absolutely no contact with Flint water, and that we are in the summer and we are expecting to see legionella cases because this is something that we routinely see. Is there any more information that you can share about that?
Well, in an average year, we typically have seen between 9 and 12 cases. This individual, we're continuing the investigation. They've completed the patient survey form with the individual. We're going to do a site assessment of some of the facilities where the person has been to try and determine if there's a potential source.
During that outbreak last year, we were never able to prove causation. We couldn't get the water sample from the person's home or where they were, but that sounds like it's being done this year to potentially find the source and match the DNA subtypes.
Right. It's my understanding that they're unable to get a sputum sample from this individual because of his health condition.
Oh.
It was advised against by his physician.
Oh.
So, Mona, just to let you know that we've been working with Genesee County Health Department, and we have certainly offered to be able to assist with any environmental sampling that they need any assistance with, and my understanding is they will be doing environmental sampling as well. So at least when there are cases that they can collect a sputum sample, that there can be some other counterpart to compare against. So I think there's a lot of hope, a lot of positive signs for certainly not repeating past.
Any other questions from anyone in the room? Okay.
Harvey, you make sure we get a copy of the slides, please.
Absolutely. Stacy will send the slides out to all the members of the committee. You'll have them. Okay. Moving on. Now, Mr. Becker.
All right. I can't punt this one over to the Wayne State team, too, can I? It worked before. I'll try it again. So I want to walk you through this morning the Health and Education Subcommittee's 17 assigned Flint Water Task Force recommendations and where we are currently with those 17 that the subcommittee is working on. We have 9 recommendations that were supported by the committee as written, and those were 6, 8, 9, 11, 13, 26, 27, 28, and 37. And I'll go through these with you as well. I don't expect you to memorize all of these from the report. We had 6 recommendations that were supported with modifications. Those were 7, 10, 12, 35, 36, 38. But those were very slight modifications. So in essence, really, we had 15 of the 17 accepted almost exactly as written. We had 1 recommendation referred to the policy subcommittee. Thank you, Mr. Zimmer. And that was number 44. We have, that's right, to the right team. And we have 1 recommendation the subcommittee requested clarification on. That's number 14. So let me just go through those briefly with you. First, report, task force recommendation number 6 was that we established policies and procedures at MDEQ and MDHHS to ensure input by health experts and scientists when permit decisions may have a direct impact on human health. Pleased to report that we do have a memo of understanding between the departments that was signed by both directors Cray and Lyon in April. The purpose of that was to ensure data and public health information is exchanged freely between the departments, and it came with a number of responsibilities in that agreement. Those included the coordination of data and information between the 2 departments, the toxic steering group that was already in existence will be discussing health risks with the departments more regularly. That toxic steering group includes risk assessors, it includes toxicologists from the Departments of Environmental Quality, Health and Human Services, Agriculture. They do meet quarterly. They meet more often if needed as circumstances dictate. And that group chair will be responsible for reports back to both Departments of Environmental Quality and Health and Human Services. The MOU also has data sharing requirements around that toxic steering group that the members will gather and review that data, that they will work with the originator of the request and on the work product that results from it. So good progress on recommendation number 6. On recommendation number 8 from the task force, this was to reestablish the Michigan Childhood Lead Poisoning Prevention and Control Commission. We've spoken about this in prior meetings. Pleased to report that the governor did sign Executive Order 2016-9 on May 20th. The commission, I understand, held their first meeting already in June, so off and running. And what's exciting about this is it's not just a reduction, but the ambitious goal of elimination, which I think is the right objective. So I think the entire group here took recommendation number 8 to another level, and that's a good thing. On task force recommendation number 9, this was to ensure that MDHHS is transparent and timely in reporting and analysis of aggregate data regarding children's blood lead levels. On number 9, we have done a number of things. First of all, the CLIP program, the child lead prevention program, the surveillance was moved to environmental health surveillance, where it's more appropriately housed and I think allows it to be more effective. We did have 3 master level public health level staff hired to augment the 2 that were already existing. We've spoken before about the limitations with the few staff that were in surveillance, so that has been beefed up, and they join a data manager and a data technician. We have data sharing agreements now with the CDC, and we do get CDC technical assistance when necessary on that analysis. And we have established procedures to ensure timely response to these data requests. Task force recommendation number 11 asked us to strive to be a national leader in monitoring and responding to exposure of children to lead by converting the CLIP program, the Childhood Lead Poisoning Prevention Program, from passive collection of test results into an active surveillance. So many of the things I just spoke to in 9 also will address 11. With CDC assistance, we are developing a blood level analysis down to the ZIPs and providers, which is necessary to get to the level that Dr. Monahan Atisha was working at here more than, well, several months ago. This data will be shared directly with local health departments and Medicaid health plans and providers. Task Force recommendation number 13 is suggesting the state as the state authority on public health and as the organization that conducted the epidemiologic study of Legionella cases in Genesee County in 2014-15 to take responsibility for coordinating with the Genesee County Health Department and the CDC to protect Michigan residents from further outbreaks of Legionella. You've already heard from the Wayne State team on the work they're doing. Genesee County Health Department has provided an enhanced surveillance plan for 2016 that we were able to review with them, and I think will be much more effective. The toolkit, I think, was big, not just for the state of Michigan, but nationally. That toolkit will be a model. That was issued for all high-risk buildings, distributed statewide in April of 2016, and the CDC distributed nationally in June of 2016. We are also attempting to schedule site visits with those hospitals where we saw the highest incidence. Task Force recommendation 26 was to improve follow-up at MDHHS, Genesee County Health Department, City of Flint. The Genesee County Health Department's in progress on additional work on this recommendation. We also, at the Michigan Department of Health and Human Services, have local health department director now in Orlando, Todd, who's interfacing regularly with Genesee County Health Department, spends regular time up here as well. Task Force recommendation 27 was to presume risk of Legionella may remain elevated. The monitoring has been more aggressive here in 2016. Wayne State continues their analysis of the entire system. Task Force recommendation 28 was to mitigate Legionella risk in 2016 and beyond. Again, this is finding that's also addressed through tools like the toolkit itself and the Wayne State project moving into phase 2. And the Task Force recommendation 37 on dedicated subsidiary funding in the Health Endowment Fund. We continue conversations with the Health Endowment. The Health Endowment Fund certainly has been receptive to all things Flint, and they are considering a number of Flint initiatives as they go through their first round this summer. So we'll see where they end up. I think we're just a month or two away from them making decisions in that respect. 6 recommendations that were supported with modification. I'll go over those just briefly here. Number 7, as I flip back, was to establish and maintain the Flint Toxic Exposure Registry to include all the children and adult residents in Flint from April 2014 to present. This is an area that we need to continue to give aggressive attention to. Registries can be very expensive. Our first shot was to try to get federal funding. We have not been successful to this point in securing that. We do continue to work with ATSDR. My take on this now is we're going to have to try to convene groups here within the state that already have some infrastructure, including organizations like Great Lakes Health Connect, the Michigan Health Information Network, because we just need to start moving forward. If we continue to wait for the federal funding, we're going to really fall behind, and as I see it, we're already behind on this, and we need to become more aggressive. To that end, I've asked our staff to begin to set up meetings with those groups so that we can get this one jump-started and hopefully accelerate that. Number 10 was to establish a more aggressive approach to timely clinical and public health follow-up for all children known to have elevated blood lead levels statewide. The focus should continue to be on high-risk populations. So our reason for this being in the category of with modifications, we want greater emphasis on those high-risk populations, recognizing that, of course, this does need to also be statewide. We've improved the case management, reporting, and documentation. we're partnering with CHAP and Genesee County Health Department on the efforts here in Flint. Number 12 was to improve screening rates for lead among young children through partnerships with county health departments, the health insurers, hospitals, healthcare professionals. We are working with the Medicaid health plans to improve the screening rates, which we know need to increase. And this will also be work that the new commission will continue to keep their eyes on for us as well. Flip back to the end for the last three in this category. 35 was collaboration among the Department of Health and Human Services, Genesee County Health Department, local health care professionals, and health insurance plans to ensure 100% of clinical and environmental follow-up. The modification here was that we suggest changing to 100% offered. We know that we can't expect every single family to take us up on this opportunity, but certainly we do want to make sure that 100% of those that are impacted and have elevated will in fact be offered. So we are offering that case management to all children known to have the elevated blood lead levels. Pleased to say that the waiver approved for targeted case management began on May 9th, and that was huge for the city of Flint and will be a big part of the success in this recommendation. Number 36 was to offer all children listed in the Flint Toxic Exposure Registry timely access to age-appropriate screening and clinically indicated follow-up for developmental and behavioral concerns by licensed healthcare professionals. This should not be limited to just those in the voluntary registry, so the reason that we put this one in the modified category was that. We are offering case management to all children with the known elevated blood lead levels. And then number 38 was the establishment of a comprehensive Flint public health program coordinated with county and state level public health initiatives that can serve as a model for population health across the state. We certainly support this, but we believe it still needs some wordsmithing and possible clarification. This is a pretty broad recommendation and very ambitious. Don't have any problem with the ambition, but we think it's going to need a little more structure and clarification. The recommendation number 44 that went over to policy subcommittee was the prioritizing health matters across all state agencies with the establishment of a cabinet level post focusing on public health. Policy has taken that on and I know is making good progress in that. And then the one recommendation from the task force report that we are seeking additional clarification on is number 14. And number 14 was the recommendation that in cases of switches in drinking water supplies in the future, assume that outbreaks of legionella cases may be related to changes in the water source. We believe this was meant to be statewide, but that's the clarification that we're seeking there, and not just KWA specific. We also suggest that that consideration should not just be narrow on legionella, but on all microbial and bacterial risks. So that was conversation on that particular finding that we suggest for clarification. So that was a pretty quick run through on the 17 recommendations for the group. I think I kept it in the 15 minutes. Any questions for me or other members of the subcommittee?
Okay, we have a question. Could you introduce yourself, please?
Yes, hello. My name is Diana McKittrick, and I am from the Communication Access Center for Deaf and Hard of Hearing. And my question is, all of these things that the task force is listing, do you have a deaf person sitting in those, any of those committees, or to be able to share advice to give you appropriate information
Okay.
First of all, let me say you're not a pain in the butt. So we welcome you for being here, and thank you for expressing that. And I know that the departments, this has been a challenge, and in making sure that we are effectively reaching into the deaf community, but the departments have taken steps to do that. So Tim or Keith or anyone here would want to add on to what that.
Yeah, my response to that, and thank you for that, it's a very important issue. So we do not have a member of the deaf community directly on this subcommittee as we've had our ongoing calls. What we've been attempting to do, though, was to relay information back through the other groups that are active here in the community. And I know there is a communications group. And Cheryl, you can correct me on this because I think you've been closer to it than I have been, but I believe we do have representation from the deaf community there. We probably need to do a more consistent job of reporting the subcommittee's work through that group. In addition to that, and others can add to that who have been directly involved, in addition to that, I'm completely open to having direct involvement on these subcommittees from members of the deaf community and other community members that think they should be a part of it, and I would be open to that.
Happy to.
Okay.
I'm happy to give you my 2 cents worth.
Okay. So.
And I would be glad to be involved because our deaf community is still clueless.
Okay. So let's make sure we connect. I'm going to look to Cheryl here to make sure before we all leave this room that we have some contact information, and let's figure out how we can make that happen as we go forward.
Right, and I will just add that Diana is on our communications subcommittee.
Great.
The community, so I have her information. So.
Okay, so we'll work towards getting a more direct plug into the work as it's occurring.
Okay, and whatever additional advice you have for us to better effectively communicate to that community, please let us know. I know that you're doing that, but if we are deficient in certain areas, please let us know. We appreciate that. Anything else? Any other questions for Tim? I just want to say, oh, go ahead, Dr. Mona.
I would just like to reiterate what he mentioned about the registry. So it has been in every federal legislation to get funding for this registry, which is critical. It was part of the task force recommendations. It's very important for us to do the long-term monitoring of the children and to share best practices and share outcomes. So we are definitely moving forward on the creation of this registry in partnership with the state, with the CDC, with ATDSDR. Michigan State University actually has something called the Bayer Research Informatics Core, which houses the National Autism Registry. Which is CDC funded. So they've been brought in to kind of help us build this with many community partners, including Great Lakes Health Connect, the Greater Flint Health Coalition, community members, and others to determine what will be in this, and it will be built very piece by piece at a time. But it's many partners are involved, and obviously the funding is still an issue.
Okay. And for those who are watching live stream, the registry is important for what reason? Because there are folks who maybe, what is a registry?
So a registry serves several purposes. It identifies everybody who was exposed to this water. The charge is actually for children and adults who were exposed beginning in April 2014 until end date not yet set. It will pool many data sources, including electronic health records. This is kind of the visionary goal. School records, criminal justice records, participation in interventions like preschool and different things. And for a subset of children, you may have more thorough developmental evaluations, neuropsych testing, executive function testing, and then we're hoping that kids can get or people can get a superhero ID card or something that can identify them that is full of positive messaging. Many other programs in different countries, they've actually had chips built into their Medicaid card, which further kind of adds the functionality and the tracking of these children. And then the output of having all this data consolidation is to assess how our kids and adults are doing. Driven by data, we'll know outcomes. So specific child outcomes, program evaluations. But we're also hoping that it could be something that can be used for care coordination, and almost like this person or this family's already in WIC, but they're not signed up for preschool, but they are signed up for Medicaid, but they're not signed up for double up food bucks. So really kind of having a universal checklist of services, so that very much having a patient portal aspect to it. We're also working with Karen DeSalvo, who is the chief health IT person for the country who's connected us with a lot of national folks who have been working on these kind of robust registries as well. So it serves many purposes, primarily data consolidation, but also we definitely want to push it to the user, push it to the people so they can be empowered to access their data and to see what else they can be what else they can be eligible for.
Thank you very much. Go ahead, Rich.
Harvey, I just wanted to add to Ms. McKittrick's comments is that there is planning underway with the city, the county, the state, and the federal government for a campaign that will likely kick off sometime around July 18th. And it's a coordinated, funded campaign of both earned and unearned media to better inform Flint residents of all the health and human services resources available to them. So I think it's going to be real critical to make sure that we not only have the different languages represented, but also the hearing impaired and deaf communities. So that'll be a good opportunity to ensure that as we do that push, that we're doing the push tailored to the entire community.
Excellent. Thanks, Rich. And just for the information too regarding the deaf issue, all these meetings are closed captioned, so we live stream them. They get closed captioned, so that's one way for addressing or providing information to that population. I just want to say in February of this year, when Nick was skiing down a slope and got hurt, Tim stepped in and at the height of all this stuff, and you did an outstanding job. I just want to let you know that your work was impressive. You were accessible, you were responsive, and I can't thank you enough for that. So we're going to miss you. Congratulations. So, okay, City of Flint. Sylvester, you had a couple comments. We're not going to go through the recommendations, so we'll schedule Flint recommendations for another time. But I know that you had a couple things you wanted to say.
Yeah, I do want to say that a small team of us have convened to discuss the recommendations, and we believe that there is a little bit more work to be done before we bring those forward. We certainly believe that we need to bring Councilwoman Vicky Van Buren into that conversation so that she's aware of the recommendations that are going forward. And so what we're hoping to do is to bring those recommendations forward on July 22nd, and that will give us some time to pull everything together. I'm sorry that Tim won't be present for that, but you set a good example. The presentations today have set a good example for us going forward. I do want to say that the mayor was hoping to be here, but certainly in light of the things that have happened in Dallas, she wanted to spend some time with the police department this morning to let them know that that she's thinking of them, she's supporting them, and so that's why she's not here today.
Thank you, Sylvester. So let me go through the upcoming steps on the work plans. As you saw from the presentation today, this is what we're looking for, the document from the subcommittee. We're asking each subcommittee member to review those documents, because when we ask for a final vote, we're not going to go through all this again. We're going, to basically push for a final vote. So if there are changes, if there are recommendations that you need to have on a subcommittee that you're not participating on, get those to the subcommittee chairs for their inclusion and discussion, because at the end of this process, you want a final vote on this so we can get this to the governor. So next week we'll have presentations from the KWA subcommittee. 2 weeks, sorry, July 22nd. And the meeting will be here again on July 22nd. KWA and also Water Quality and Infrastructure Subcommittee. On August the 12th, we'll have 3 presentations, the communication, policy, and then we will have a final review of all the subcommittee recommendations. So on August the 12th will be our time to recommend, modify, suggest changes on information that you may not have participated on because you're working on a different subcommittee. And then on August 26th, we'll have a final review of the communications and policies. I got to talk to you about that because it's in my notes, and so I'm just reading your note. So that's a duplicate. So we'll have a final vote on all the recommendations on August 26th, and on September the 2nd, the chairs will submit a letter for recommendation to the governor for the recommendations from the task force, and we'll be done with this particular project. And if you have any questions about that timeline, let us know, and we'll fit the city in probably around August the 12th, maybe. We'll see if we can get you in on that date, and be done with it for the presentation. Okay. Is that enough? Good time for you to August the 12th? Okay.
Probably could do 22 July if you can fit it in.
We could. Yeah, we'll work it.
Just 2 weeks.
Okay, we'll work it. 2 weeks.
Yeah.
All right, there you have it. July 22nd, the city will go. Any questions? All right, and the rooms for the August the 12th and 26th, the locations are to be determined. We'll let you know. I don't have any closing remarks. If anyone have any comments to make on behalf of the committee, or any things that you want to bring to the attention of the committee before we break. I enjoyed leaving it. Go ahead, Rich. I was going to call you Dr. Beard, but
That would be nice,
he said,
but it wouldn't be true. I just have a couple of things that I wanted to say, and these are positive things, not necessarily within the remit of FWICC, but things that we've all been working on, and just some highlights. And feel free if Kyle Garant from Department of Education or anyone else wants to weigh in more specifically. But I wanted to highlight the fact that already this summer, 1,500 individuals, including 800 children, have been participating in the summer feeding program, which has a really big nutritional benefit. Kyle's had a big part in that. Flint school nurses are continuing through the summer, and they've served the needs of 2,000 public schools children so far. And so we're very proud that we were able to set up that degree of medical monitoring. And I think I've got these numbers right. I hope it's right. 16,000 Flint residents have now been added as a result of the healthcare expansion waiver. And those are game changer kinds of numbers. Now, it doesn't mean that all of these individuals are yet, in queue getting the services that they need, but it's the target audience that we need to go after, and why this campaign that we're going to be launching soon is so important. So I just think those are things that we all should be focused on as a opportunity outcome of a crisis that's occurred as a result of people coming together and say, what do we do next?
Good deal. Dr. Mona?
Yeah, it's amazing. And I would just reiterate that the Medicaid expansion has had a slow uptake rate so far. So that's why this campaign that's coming up next week is so critical. And this increases the eligibility of Medicaid. So the income eligibility is up. In addition, the age criteria is up. It goes up to 21. And it can be someone's second insurance. So even if you have commercial insurance, you can still get this Medicaid. So it allows you to get all these additional wraparound services. So Cheryl has the phone number maybe for the sign up. No, not yet. Well, there's signs everywhere. Call 211. But so far, not many people have signed up. So this campaign is very important. But please continue to spread the word that we have these incredible resources. We also have the summer EBT cards. I don't know if Kyle wants to talk about that, or somebody. There's kids now can have EBT cards over the summer, and the sign up for that has been low. So people need to be aware of those things, and that will be part of that campaign too.
That's a good point that you make. You said 16,000 are in it right now?
They're potentially eligible to be added.
Okay, 16,000. And how many? Vary.
Well, the 16,000, what that includes, those wouldn't all be new folks that previously had no coverage. It includes some that are now eligible for the enhanced wraparounds that the doctor just spoke to. So the new number that's in, Cheryl might have, But the 16,000 includes those that would have potentially already been on, but can convert over to the waiver and
Gotcha.
get the additional wraparounds, which is also very important. So even though the uptake has been slow, we auto-converted a number of people that were eligible, and that gives them access to those.
So a portion of them
additional-
are already covered.
Correct.
Okay.
But now have greater coverage
Gotcha.
on services that they would not have previously been allowed.
Sure.
Oh, I thought I had it. I don't have it on here. I have the old one.
Okay.
Yeah. But the number, the number to call in order to register, there's a couple of different numbers that you can call. For the Michigan Helpline, it's 1-855-789-5610. And for the deaf and hard of hearing, the number is 1-866-501-5656.
Can you repeat the first number again?
1-855-789-5610. And again, for the deaf and hard of hearing, 1-866-501-5656. You can also go to www.michigan.gov/mybridges, and when that pops up, there's a banner that will alert you if you're looking to sign up specifically for the Flint water healthcare.
Okay, excellent. Kyle?
Harvey, just to address Dr. Antич's point about the SVT cards, I mean, it's been a little slow uptake in terms of getting families cards and getting them pinned, actually using the resources. So today, as of yesterday, we have a little over 50% of the eligible families. It's a little over 14,000 families that have activated their SCBTC cards, and a little over 10,000 of those have actually started redeeming the cash value on those cards. So it's a little over $300,000 as yesterday. So we still got a ways to go, but it's gaining momentum. People are activating them a lot quicker than they were, say, 3 weeks ago. On the other flip side of that, with the money that was in the recently passed supplemental, we have a very similar program that we are trying to do for families with children 0 to 5, because the resource that I was just talking about, that's funded by USDA, and it's only for school-age kids, so K-12 population. The resources on the supplemental, the state money, is going to be targeted towards 0 to 5 population for very similar things. Now, our hope in the beginning, when supplemental first was discussed back in the wintertime, was that we would start this to be ready for the summer. And now that the bill isn't signed until last week, we've had to kind of change our plans. But in working with Tim and his group at HHS, we're going to do very similar things. We're going to add, instead of having a separate card, we're going to add those resources to SNAP cards that families already have, and that will allow them to start redeeming points or redeeming the cash value for food during the summer months, but it'll also extend into the next school year. So it's not just limited to summer. So we had to kind of change up our plan a little bit, but essentially the same concept. How can we get resources to families that are mobile to redeem healthy fresh fruits and vegetables? And as part of using the SNAP card too, they'll also be able to use it as part of their double up food bucks. So it's essentially doubling our value of those dollars. So.
And they've had a huge campaign now in Flint to increase the awareness of double up food bucks.
So the target population is about 30,000 for you?
For the school age population, so it's a little confusing. Again, the USDA money that's there right now for the summer it's only for K-12 population. That's just what the feds will fund. So, but yeah, there's 27,501 families that are eligible in Genesee County.
In Genesee County, so it's just not Flint then.
Yep.
And then of that population, you said 10,000 are currently drawing down on their. Okay, so
a little over 14,000 have actually activated their cards.
They're activated, but 10,000
so
are.
10,000 of them have actually started redeeming using the dollars on those cards.
Okay.
And then one thing I do want to add, I'm very excited about, is a lot of the families for the new summer program did not receive their cards until like the last week of June. And initially, you had to use your benefits in the months it was received. Well, now you'll be able to carry it over, and they all have to be used by September the 5th. And I think that's really critical for us to spread the word about that. Families will be getting a letter. It's coming out probably next week.
Okay.
In regards to that, so.
Okay. Any other statements? Good for the cause? If not, we are adjourned for today. Thank you.